Finding the best health insurance in 2025 doesn't have to be hard. This guide makes it simple to pick the right plan from top companies. All plans on the health insurance marketplace, also called Obamacare, cover 10 important things like doctor visits, hospital stays, and medicines. We'll explain what to look for, keywords to know, top insurance companies, how to choose a plan, and new rules for 2025. By following these easy steps, you can find a plan that fits your needs and budget. Let's get started with clear, simple advice to help you choose wisely. First, think about what you need from a health plan. Do you visit doctors often, maybe for a health condition? Pick a plan with low copays, like $30 per visit, or a low deductible, the amount you pay before insurance helps. Plans with low monthly payments, called premiums, might cost more when you get care, so check your budget. Do you have favorite doctors or hospitals? Make sure they're in the plan's network to avoid extra costs. If your income is low, like $22,590 or less for one person, you might get discounts on marketplace plans, especially silver ones. Key terms to know include premium, monthly fee, deductible, up to $9,200 for one person in 2025, copay, fixed fee for visits, coinsurance, percentage you pay after the deductible, like 20%, out-of-pocket maximum, most you pay in a year, up to $9,200 for one person, and network, doctors and hospitals your plan covers. Plans come in types: HMO, cheaper; network only, PPO, more choice, costs more; EPO, network only, no referrals needed; POS, mix of HMO, PPO, needs referrals; and HDHP, low premiums, high deductibles, good with a savings account. Knowing these helps you pick the right plan. Next, let's look at plan levels and top companies for 2025. Marketplace plans are split into 4 metal tiers based on costs: bronze, lowest premiums, highest deductibles, best if you're healthy; silver, medium costs, great for discounts; gold, higher premiums, lower deductibles, good for frequent care; and platinum, highest premiums, lowest deductibles, best for big medical needs. Top companies include Kaiser Permanente, with low premiums, $501 per month, and great service, but only in 8 states, like California, Colorado, and Washington, D.C., and HMO only. United Healthcare has a huge network, 1.3 million doctors, 6,700 hospitals, across 30 states, but premiums are higher, $553 per month. Aetna, CVS Health, offers low copays and free CVS Minute Clinic visits, good for young adults, but it's leaving the marketplace in 2026. Blue Cross Blue Shield covers all 50 states with a big network and high satisfaction, though costs vary. Humana is great for employer or Medicare plans but has few individual marketplace plans. Check if these companies are in your state, as availability differs. Look at reviews from places like NCQA or JD Power to see which companies, like Kaiser or Highmark, score high for service. To pick the best plan, follow these steps. Start at HealthCare.gov or your state's marketplace, like Covered California, to see what's available. Compare premiums, deductibles, copays, and out-of-pocket maximums using the marketplace's preview tool. Call your doctors to confirm they're in-network. Blue Cross Blue Shield's Blue Card program helps with nationwide access. If your income qualifies, apply for premium tax credits or cost-sharing reductions to lower costs. Check the plan's benefits, like medicines or mental health care, in the Summary of Benefits and Coverage document. Enroll by January 15, 2025, for 2025 coverage. If you miss this deadline, you'll need a life event, like marriage or job loss, to sign up. You can also check employer plans, which might be cheaper, or buy directly from companies like United Healthcare, but compare with marketplace plans for savings. Licensed brokers can help but might charge fees. Avoid scams by sticking to trusted sites like HealthCare.gov and never sharing personal info with unknown websites. Call 1-800-318-2596 for free help if you're confused. New rules in 2025 might affect your choice, so pay attention. The One Big Beautiful Bill Act adds stricter checks for income and immigration status, which could slow down sign-ups. Auto re-enrollment is ending, so you must actively choose a plan. Over 24 million people lost Medicaid coverage since 2023, so if this affects you, look at marketplace plans for affordable options. Discounts called premium tax credits might end after 2025, raising costs, so sign up now to lock in savings. Short-term plans are limited to 3 to 4 months and don't cover all Obamacare benefits, so they're not great for full coverage. Always double-check that your doctors, hospitals, and medicines are covered to avoid surprises. Reading customer reviews and asking for help from HealthCare.gov or a trusted agent can make choosing a plan easier and ensure you get the best coverage for 2025.